Hyperthyroidism will drastically impact your pet's life if left untreated. Hi, I'm Dr. M. Welcome to VMC. Join me today as we cover symptoms, causes, treatments of hyperthyroidism so that you can be proactive in your pet's care. Join me. You'll learn something today. Hyperthyroidism is the term for when there has been an increased production of T3 and T4, some thyroid hormones, in your animal's body. Most commonly, this happens to cats. It's a lot less likely to occur in our dogs. The thyroid gland is situated in the neck of our cats and our dogs. Most commonly for cats, hyperthyroidism is caused by a non-cancerous or benign tumor on their thyroid gland known as an adenoma. It's less likely but possible for there to be a cancerous tumor called an adenocarcinoma. Thyroid hormones impact many other parts of the body, so it's common that we see secondary medical issues pop up as well. Elevated thyroid hormones cause an increase in heart rate and an increase in how hard the heart contracts during every beat. Over time, this can cause the heart muscle to thicken, especially in the left ventricle. If left untreated, this will eventually compromise the heart's function and it will lead to heart failure over time. However, once the hyperthyroidism is controlled, if caught early enough, it's possible that the heart disease can be reversed to some degree, and sometimes it will even resolve completely. Hypertension or high blood pressure is also another common secondary issue caused by hyperthyroidism. And about 20% of our cats that have hyperthyroidism will also have hypertension. When the blood pressure is too high for a sustained period of time, this causes harm to a number of other organs in the body, including most commonly the eyes and the kidneys, but it can also impact the heart and the brain. As a result, if your cat has hypertension, they may also need medication to control their blood pressure while we start to control the hyperthyroidism. Over time, the blood pressure may resolve itself and go back to being a more normal blood pressure, and in those cases, those cats can often come off of their medication for their hypertension. Thyroid hormones are also involved in setting the metabolic rate for the cat, and so cats that are hyperthyroid will also often have an elevated metabolic rate and they will burn calories too quickly. These are kind of the most common secondary issues that we see with hyperthyroidism, but there are other possibilities as well. As I mentioned before, the most common reason for cats to become hyperthyroid is because of a non-cancerous tumor on their thyroid gland on one or both sides. It will only be roughly about 2% of hyperthyroid cats that end up having an aggressive tumor on their thyroid. In dogs, we just presume that this will be a thyroid carcinoma, and it does unfortunately mean that they have a poor prognosis. This is in stark contrast to our cats, who we are often able to treat successfully and who often go on to live a long life after diagnosis. We don't know why cats are so prone to developing these benign tumors on their thyroid gland. We have a few speculations. Absolutely, we can see animals become hyperthyroid if they are fed unbalanced, poorly formulated diets. Most often these days, this is associated with raw diets, unfortunately. We can also see it if the diet has an excess or deficiency in other micronutrients that our animals need. Often this has to do with an excess of iodine, but there are also some theories that there might be some thyroid disrupting chemicals that we are being exposed to, and our cats may end up being a bit more sensitive, and so then they are more prone to developing hyperthyroidism. But we don't know that for sure. We need more research in this area. There are a number of symptoms that we will commonly see in our cats that have hyperthyroidism. One of the biggest is that they will have an increase in appetite while their people will notice that they are still losing weight. They will also tend to have increased thirst and urination. Another common symptom that I will have clients complain about is that their cat has started becoming a little ornery, or they might increase their vocalizations. This seems to happen a lot at night, where people will start to complain that their older cat is now talking a lot, especially at night, disrupting their sleep, acting a little bit hyper, overactive, that sort of a thing. Some people will talk about irritability with their cats. We might see vomiting and diarrhea, and often we will see that they look a bit unthrifty. Their coat just looks a bit unkept. They don't look quite as sleek and healthy as they otherwise would or should. The typical cat with hyperthyroidism will be middle-aged to older, with the average age of diagnosis being around 12 years of age. When we go to diagnose hyperthyroidism, what's crucial is that we don't forget about the common secondary side effects that hyperthyroidism causes. So we start with a physical exam, and we can sometimes even feel the enlargement of the thyroid on the cat's neck. We can't always, but sometimes we can, and that can help guide our diagnostic tests. We usually will need to send out a senior blood work panel though, and in that blood work panel we are checking for the total thyroid levels in the cat's blood. The majority of the time, hyperthyroid cats will have an elevated total thyroid level. However, there are some cats that may have a normal total thyroid level, and in that case we may need to run a secondary, more specific thyroid panel if we're still suspecting hyperthyroidism. Of course, it's also crucial that we check for a high blood pressure, and we also need to check how the kidney function is doing, which is part of our senior blood work panel as well. Additionally, your veterinarian may be recommending an investigation into how your cat's heart is coping, depending on what else is going on with your cat at that time. We will often do things like chest x-rays and an ultrasound of the heart to see if the hyperthyroidism has impacted the heart health in any way. Now, we do have a few treatment options for hyperthyroidism. Almost all cats will need to start on a medication to reduce their thyroid levels. These medications are called anti-thyroid drugs. You may know it as methimazole or filimazole, and these medications work to reduce the amount of hormone that the thyroid ends up producing. These are in no way a cure for hyperthyroidism. All they help us do is manage it while we consider other more permanent treatment options. The advantage of using these medications is that they are fairly inexpensive, and they do allow us to titrate the dose that we give in order to better control the amount of thyroid hormone in your cat's body. Of course, as with any medication, there are the possibility of side effects. Most commonly, we'll see vomiting and diarrhea as the side effect. However, some cats will get a very intense facial pruritus where they can get very itchy. It is pretty rare, but some cats may end up having clotting issues or become anemic. If we rely solely on medication as our treatment option, it is something that is required lifelong, and it also means that we need to do regular blood work panels because the amount of medication that's required will tend to change over time. If you are giving tablets to your cat to control their hyperthyroidism and you need help with how to go about that, I do have a video where I cover the steps for teaching your pets to take medication on cue. I will link that in the description below. If your cat ends up not being able to tolerate the tablets, we can sometimes use a transdermal medication. It's kind of a lotion or a gel that you end up applying on the ear. This can be a bit tricky because we don't always get great absorption of the medication, so it's a bit less reliable control of the hyperthyroidism, but it may be an option. After we've started treatment for the thyroid, we also must continue to monitor the blood pressure and kidney function, as we know that hyperthyroidism can cause kidney disease, and as we bring the blood pressure back down, sometimes we can start to unveil more kidney disease than we initially thought was present. So it's important that we continue checking blood work panels over time. When an option, radioactive iodine therapy is this treatment of choice for cats with hyperthyroidism. I-131 is absolutely incredible. What it does is when your cat is treated, the radioactive iodine is given via an injection, and the hyperactive thyroid tissue will absorb the iodine, and it will end up stopping the thyroid from producing so much thyroid hormone. And this truly can be a cure for these cats. It's successful over 95% of the time, which is incredible and amazing. The one downside is that the cat does have to stay in the special clinics that do this treatment until they are safe to return home, because they do urinate radioactive urine for a while, and so they will have to stay hospitalized. It's usually 4 or 5 days until they're able to come back home. But as I mentioned before, over 95% of these patients will have normal thyroid levels within a couple weeks of treatment. It's amazing. The radioactivity carries no risk for the cat. The only concern is for any people that might come into contact with the cat for the few days where they are eliminating out that radioactive isotope. For that reason, there are only special facilities that are allowed to do this treatment. It is very rare, but it's possible that the radioactive iodine may cause your cat to actually have the reverse issue where they become hypothyroid. Then what we end up doing is giving them medication to supplement their thyroid hormone, and that will manage their hypothyroidism. Now, for the patients that have an aggressive thyroid tumor, we can consider things like a thyroidectomy. We don't really recommend this for patients with the non-cancerous tumors because it is very invasive, and there's also risk because the parathyroid gland lives very close to the thyroid, and it helps to control calcium levels in the blood. And these parathyroid glands are absolutely crucial, so if they get damaged during a thyroidectomy where the thyroid gland is removed, that can cause significant problems. For all of these reasons, surgical removal of the thyroid gland is rarely recommended as treatment. Of course, the exception is if there might be an aggressive tumor that's present. Last, I do want to cover the possibility of using the prescription Hills YD diet. There's some research showing that really carefully restricting the amount of iodine that is fed to a cat may be an effective hyperthyroid treatment for some cats. We tend to only consider this for patients where the other treatment options aren't possible. Dietary restriction of iodine is a little bit controversial, however, because we don't exactly know the long-term impacts of doing this. We need more research in this area, and it won't be effective for all patients. It's also a bit of a pain because literally the only thing that can pass your cat's lips is the prescription YD diet. No treats, nothing else whatsoever, because then they have no hope of their hyperthyroidism being controlled. So we tend to reserve this potential treatment only for patients where the other options are not working or are not possible for some reason. It will also be important to regularly see your veterinarian for blood tests and repeat physical exams and for checking blood pressure and so on. You'll also need to be very aware of any changes for if your cat's symptoms get worse or change in any way. And because treating hyperthyroidism will often unmask some kidney disease, it's absolutely crucial that you're working closely with your veterinarian to manage any other issues that your cat might be experiencing. As you know, I like to be all about prevention when and where it's possible. For most cats, we're not able to prevent hyperthyroidism, however. What we can do is be proactive in checking for hyperthyroidism and high blood pressure. We should have our older cats seeing a veterinarian at least every 6 months, and they should also be having regular blood work panels so that we can monitor how organ function is and so that we can catch issues as early as possible. The earlier we catch them, the less likely the hyperthyroidism will have impacted the rest of your cat's body, which is better for their long-term outcome. If you have any questions or a topic you'd like me to cover in a future video, please comment it down below. I do put out a video most Fridays, and I cannot wait to see you in the next one. You take care. Bye. Radioactive iodine therapy is this treatment of choice for cats with hyperthyroidism.